Hello, my name is Gabriella Miller, and I will be addressing nurse-to-patient ratios in healthcare. When individuals seek healthcare, they expect to receive reliable, high-quality medical care from qualified professionals. However, underlying this expectation is a frequently overlooked issue of the high unsafe nurse-to-patient ratios that can jeopardize high-quality nursing care. This is a critical issue within healthcare and causes negative consequences to both patients and nurses. Nurses are the main bedside support for hospitalized patients and directly impact patient outcomes. The overwhelming workload of each nurse leads to burnout, fatigue, and low job satisfaction. High nurse-to-patient ratios negatively affect the quality of patient care and the well-being of staff and the overall functioning of hospitals. Lassiter et al. Explains the lack of nurses in hospital settings increases errors, morbidity, and mortality, and decreases patient satisfaction. These consequences are life-threatening but also preventable. Developing and implementing policies that ensure safe nurse-to-patient ratios are essential to protect both patient outcomes and nurse well-being. First, we need to understand what nurse-to-patient ratios are. Nurse-to-patient ratios are the number of patients a nurse is assigned to during a shift. These ratios are an indication of the quality and safety of the care the patients are receiving, as well as the ability of the nurse to meet the patient's health needs. According to the American Nurses Association, minimum nurse-to-patient ratios are one of the many alternatives and solutions to achieve appropriate nurse staffing. Staffing levels of nurse-to-patient ratios depend on the unit and department. For example, the intensive care unit, or also known as the ICU, has a ratio of 1:1 or 1:2 due to the complexities associated with patient care, while medical surgical units ratios range from 1:5 or 1:6. Emergency departments may vary depending on the patient acuity and staffing with ratio levels of 1:3 to 1:6. Unfortunately, these numbers often exceed what is deemed safe due to the nursing staff shortage. The relationship between staffing levels and workplace stress nurses experience affects the care patients receive. The higher the nurse's workload is, then the less time patients have with their nurses. Nurse burnout and fatigue have become a concerning part of the nursing profession, especially with rising nurse-to-patient ratios due to the nursing shortage. High workloads and insufficient staffing leads to nurses being chronically, emotionally, and physically exhausted, which compromises patient care and nurse retention. Levens highlights a direct link between staffing levels and nurse well-being. They found that each additional patient per nurse was associated with 23% increase in the odds of the nurse burnout and 15% increase in the odds of nurse job dissatisfaction. These statistics show the impact that inadequate staffing can have on nurses' mental health and job satisfaction. This job dissatisfaction negatively affects nurse retention, leading nurses to leave the profession early. Haddad et al. Found that the nation average for turnover rates is 8.8% to 37%, depending on the location and nursing specialty. This turnover exacerbates the ongoing nursing shortage and is a cause for unsafe nurse-to-patient ratios. Nurse burnout not only affects nurses' well-being, but also affects patient care and satisfaction. Levens found that one of the key factors for nurse burnout is chronic stress caused by patient overload. When a single nurse has so many patients on the shift that they are unable to deliver all required care or effectively perform patient surveillance required to maintain optimal patient outcomes. Overwhelming the nurse affects the nurse's performance and places patients at a greater risk for medical errors and complications. Excessive nurse-to-patient ratios are related to negative patient outcomes such as morbidity and mortality. When nurses are assigned too many beds, They are unable to provide timely assessments, interventions, and monitoring of their patients. Therefore, patients are at an increased risk for negative outcomes. Research has shown a direct correlation between staffing levels and patient deaths, such as after adjusting for hospital and patient factors, the odds of 30-day mortality for each patient increases by 16% for each additional patient in a nurse's workload. Patients in hospitals with higher nurse ratios are more likely to have complications such as infections, prolonged hospital stays, and unplanned readmissions. Poor nurse staffing can lead to delays in care, increased medical errors, thus affecting patient safety. When nurses are overwhelmed, they may unintentionally delay or forget critical tasks, which is referred to as rationing of nursing care, which is the unintentional withholding or delay of provision of nursing care essential to maintaining the health and well-being of patients. This can lead to and includes medication errors, falls, pressure ulcers, and other complications. These delays are not due to intentional negligence, but are related to the lack of time and resources. Nurses must prioritize tasks while overwhelmed, which increases the risk of mistakes and missed interventions. Over time, this contributes to poorer health and longer hospitalizations and higher rates of patient dissatisfaction. Addressing nurse staffing shortages is important in order to reduce medical errors and promote safe, effective care. High nurse to patient ratios also have been associated with poor patient satisfaction, which is measured by a hospital consumer assessment of healthcare providers and system scores. According to Spalding, the highest association with these ratings are found with work environment, followed by favorable staffing. It was concluded that the best performing hospitals had better resources, that hospitals with poorer resources also scored poorly, suggesting that improvements in both work environment and staffing work together to boost patient experience ratings. When nurses are overwhelmed with too many patients, they have less time to provide individualized care, leading patients to feel neglected and frustrated. Minimum nurse to patient ratios allow nurses to provide high quality care to make patients feel seen, heard, and cared for. Implementing and maintaining safe nurse staffing is not only important for patient outcomes, but for also maintaining the trust and satisfaction of patients. Investing in safe staffing models ultimately supports both the patient experience and hospital outcomes. One way to improve nurse staffing conditions is through legislative mandates to regulate staffing. California Assembly Bill 394 was an important legislative step to mandate minimum nurse to patient ratios in acute care hospitals. The law was implemented in 2004 to strengthen patient safety and improve nurse working conditions, such as a 1:5 ratio in medical surgical units and a 1:2 ratio in the intensive care units. Having all states adopt a legislative bill similar to AB 394 would benefit hospitals, patients, and nurses. Evidence demonstrates that the mandated ratios in California provide positive effects on patient outcomes and improve nurses' perceptions and job retention. If study hospitals had staffed at a 1:4 ratio during a 1-year study period, an estimated 1,595 deaths would have been prevented, and hospitals would have collectively saved over $117 million. This data should motivate hospitals and states that safe staffing not only benefits patients, but is financially beneficial. In addition, it is important for hospitals to retain experienced nurses to sustain adequate staffing. Implementing an internal nurse float pool includes a group of trained nurses who can work in multiple departments to cover absences and patient surges. This strategy maintains adequate staffing and will decrease negative effects of the nurse shortage on patients and nurses. Nurse turnover can cost up to $67,000 for one nurse, but hospitals can use incentives to retain nurses and keep their staff feeling valued and supported. The American Nurses Association provides strategies that hospitals can use to enhance nursing recruitment, such as offering signing quarterly referral or retention bonuses, providing above average paid time off for your area, reimbursing them for continued education courses, and student loan repayments. In conclusion, prioritizing safe nurse-to-patient ratios will decrease patient mortality and medical errors while increasing patient and nurse satisfaction. It is imperative that action be taken at the state and institutional levels to create and maintain safe working environments for nurses. Implementation of safe strategies protects patient safety, improves nurse retention, and sustains the healthcare workforce. Thank you.